Great. So thank you. Good afternoon, everybody who's viewing. Thank you so much for everything you've done to get us to this point, which is that we've had a really successful beginning of the school year, first almost half of the school year, and it's really as a result of the collective hard work of the district, of our teachers in classrooms, of our front office staff, of our multilingual liaisons, of our custodial staff, everybody out there, and our nurses who've been around the clock recently, working through this to make sure that our schools are safe. So I just want to thank everybody. I know I missed a bunch of people on that list. I always tell myself, don't start listing names because you'll forget names of types. So I apologize if I missed you, but I really am grateful for the entire staff for the work that you all have done up to this point. If we go, we forward along, Russ. We wanted to pull together today because, as you know, we had to move to remote learning on Friday because of the number of positive cases that we had in our buildings, and we needed to make sure that we needed to regroup and to recharge. And we wanted to spend some time with you this afternoon talking about where we are, what the process is when there are positive cases, and what we're doing to prepare so that when we come back on January 4th, we're prepared to be back in school. So I'll do a quick overview on the next slide, and we'll do introductions, and then we're gonna Becca McCray, our COVID coordinator and all-star leader through all this, is going to walk us through the overview of contact tracing. We're going to go talk about what you can do, what you have been doing, testing, FFCRA expiration, and then a quick closeout. So if we advance one more. So for where we are now as a district in Burlington schools, we have 24 cases. So we've had 24 positive cases in 12 days. We currently do not have cases at Champlain, at Hunt, at our 9 BTC locations, at Property Services, at Food Services, and our administrative offices. But one new piece of information that we received today, which is really important, and we're going to need to spend time talking about this and addressing this, is that we learned today that we do have evidence of a school spread. Spread is very limited in school, and I've been saying we didn't have instances of school spread, but I learned today that we have. We learned today that we have. So we'll talk about that, and then talk about our plan for January 4th, what we can do to prepare and to be ready to come back on January 4th. And that conditions are likely to be about where they are now when we come back. And so it's going to be really important for us to understand the entire process, to make sure that we're following all of the requirements, and to be fully informed in our decision making. I think it's really important to know that the Department of Health, we've been working really closely with the Department of Health. We have Dr. Brianna Holmes here with us today, and we'll have other representatives here today, likely to help us talk through this with you. We've been working hand in hand with them throughout this process, and they continue. And as of even Friday, when I made the decision to go remote on Monday and Tuesday, they told me that schools are safe and that we can be in the schools. And so that is really important, and something that we need to remember, is that we have the ability to keep our schools safe, and we need to, and so we're going to continue to plan for coming back to school, and making sure our schools are safe when we return. We have a group of folks with us today. I've mentioned everybody. Oh, I haven't mentioned Russ Ellick, our communications director, who's here, and then Sally Kirshner from the Department of Health is also, we think, going to be joining us in a few. I want to
we put Shannon on there. Shannon can't be with us, but Shannon has been like our rock in our district. So we just wanted to make sure that we were able to say thank you to Shannon publicly for answering calls at all hours of the night, every day of the week. I think she finally got one day off last weekend. So thank you, Shannon.
Yeah, Shannon's been a huge support for us. All right, off to Becca.
Hi, there's my picture. Russ said we had to put it in here, so that's why it's there. We can go to the next slide. So I want to just briefly let you know that Dr. Brina Holmes, who has been working tirelessly in the Vermont Department of Health since May or since March, actually, in the COVID response team for the Vermont Department of Health. I asked her to join us today because I think it's really important for people to understand that we are doing contact tracing in the schools, but it's really just a speck of what the Vermont Department of Health is doing broadly. And so Brina is going to talk about that broader picture that we are just a tiny little part of.
Okay, do you want me to do that now, Becca?
Take it away.
Yeah, so a lot of this, hi everyone. So by way of introduction, I just finished 10 years as the maternal and child health director, and I chaired the task force for Strong and Healthy Start, the guidance. And I just wanted to echo Superintendent Flanagan's observation that it's a 42-page document. It was an all hands on deck experience to watch facilities managers, your building people, your food services, your classroom staff, teachers, the school nurses, the COVID coordinators all pulled together to make sure our schools were safe. And it is a milestone to get to today, tomorrow. And really, honestly and transparently, we did way better than we expected. We really knew there would be cases in schools, and we knew that we were going to have to all pull together to keep kids in person whenever possible. And we're just starting to measure it as a team and feel a great deal of gratitude toward you all, and also for the students. I think March until June was extremely difficult, and there was a lot more joy and engagement of our young people in person. So thank you. And yes, the term contact tracing gets somewhat conflated in our conversations, and it's still a very large part of the health department response. However, we recognized back in October that schools were hearing about cases before the health department. And that speaks to the relationships in your community and the way people share information, which is terrific. We also knew that we had very skilled school nurses and COVID coordinators who could very quickly get with classroom teachers, families, and identify communication that would need to go out about a group of people that may be at risk for being a close contact to someone when you had a positive case. And that term, contact tracing, started to be overlaid onto that process. But contact tracing is bigger than that. So what schools have done and what Becca has done for your district for the last few weeks is Herculean. And it requires a lot of doubling back, asking again, re-questioning, figuring out where everybody was, how long they were there, and what their distance was. So that piece led to early communication, frequent communication, and revisiting. But then back at the shop, the health department has then taken each of those individual cases and people that are identified as close contact to those people and called them and gone through the, do you understand quarantining? Do you understand what that looks like? And what are the options for you to be tested as a close contact to determine whether or not you yourself have the virus? So we just wanted to start there by not, by recognizing the role schools played in the response, but also acknowledging that there's ongoing efforts with our health department team to figure out how it all fits together. And it was, hard but important that Superintendent Flanagan just led at 4 p.m. with the investigative result that in one school there does appear to be. And remember that the whole epidemiologic discussion with each student and each staff that has COVID or is close contact leads to an observation that there's still mostly community transmission. Because when you look on the map of the health department that we put up every day of cases, Chittenden County has had a very rough couple of weeks in terms of sheer number of cases. So I'll stop there. I have a lot more to say always, but I'm going to let Becca keep rolling along. But I'm here as an advisor to the process and to, just really be available to you all. Becca and I talk all the time, so you're in good hands here.
Thanks, Brina. So I'm just going to take you through the different steps of the whole process. So we start with someone going and getting a COVID test, and the lab determines that they are either positive or negative. When the result comes back, it is reported to the positive person by the place that they were tested at. So they're going to be notified by primary care if they got it from their doctor's office. They're going to be contacted by urgent care if they got it at an urgent care center, and they're going to be contacted by the Vermont Department of Health only if they were at a Vermont Department of Health sponsored pop-up clinic testing. So once that person has been notified by the proper places of where they tested, that place where they tested then notifies the Vermont Department of Health that they had a positive. And so the Vermont Department of Health then contacts that person to begin the contact tracing system with an interview. If the positive person is an adult, then that interview takes place with the actual positive person. If it is a student, the interview is conducted with a legal guardian or a parent. So I think that's really important. The things that they ask them in that interview are things like, where have you been? Have you had any symptoms? When did your symptoms begin? Where did you get tested? Why did you get tested? Where did you get tested? So those are the types of questions they ask. They ask a lot more than just that, but those are just the basics. So in that interview, they do gain permission from the individual to share their name with the school team so that we can conduct the best contact tracing that we can possible. And then this is when the Vermont Department of Health would contact the school administrator or the school nurse to let us know that we have a positive case. That being said, sometimes, like Brina mentioned, we would sometimes bring it the other way, and we contact the Vermont Department of Health and say, we've heard about this kid, here's the date of birth, what do you think? And they then look in their system and we can go back and forth. So this is a mutual relationship, goes back and forth. They cannot tell us anything definitive until they gain permission from that parent or guardian or that staff person to share their name with us. So we can share information with the Vermont Department of Health, but nothing actually happens until we gain that permission. Next slide.
Thanks. And just to clarify, you said it goes both ways, and you had said sometimes we reach out to the Department of Health to say we heard this kid, but it could be this kid or this staff. So when we're talking about positive cases in our district, we can't give you the breakdown, but what we can say is that the positive cases are are representative of both students and of our staff members. So that's important to keep in mind.
Yes. Thanks, Russ. So the second step in this is that once we confirm, once the Vermont Department of Health contacts us and says this person it has tested positive, we confirm whether they were in school during what's called the infectious period. And so the infectious period is determined by going back 2 full days from their onset date, which is either a positive test date or the date that they were first showing symptoms, whichever one comes first. If they were in school during that infectious period, then we set up a meeting with the school team and we start contact tracing. If they were not in school during that infectious period, then that case remains in the Vermont Department of Health domain contact tracing team. So it does not enter into a school contact tracing system or process.
And it also does not get included. A lot of people have seen the chart of positive cases in schools. And so that is not something that we are going to report out as being a case in our school if that person wasn't in our schools during the infectious period. And that's the guidance that we've received from the Department of Health, and also the way that they are tracking cases in schools.
And the information about the symptom onset date to determine that information comes from a wide variety of sources. It can come from medical records with their primary care provider. It can come from a school nurse visit. It can come from the interview itself. So there's lots of different ways that information comes to light. This is why it's so important that if you're not feeling well, you should stay at home. Because if you just go in the morning for a little bit and you're in that infectious period, we have to contact trace the whole day. So that, and it also affects other people. So staying home when you're sick is super important. So once we create a team, it's usually the principal, the school nurse, and then anyone else they identify as needing to be on the team for support of the process. We start an initial meeting with the Vermont Department of Health where we are briefed on the dates the people were in school. We confirm that they were in school those days. We then try to start to look at that person's day in the building. What does it look like? Where would they go? How do they get to school? What do they do after school? How long are your classes? What does lunch look like? What does recess look like? Who might have been within 6 feet for more than 15 minutes? And we try to figure out the clarifying questions that we need to get more information about. And so we leave that meeting to conduct interviews of people about their days to gather information for the answers to the questions that we need to determine more definitively who close contacts may be.
Can I just interrupt one thing, Becca? About halfway through our response, the CDC changed. The 15 minutes is now cumulative in a 24-hour period. So early on, it was a 15-minute period altogether, and then with some increased information actually from Vermont's experience in the correction system, the CDC changed that if you have 5 minutes at noon and 5 more minutes at 2, and then 5 minutes at the end of the day, that's the 15 cumulative for if you're under 6 feet. Maybe, I'm so sorry you're getting to that, Becca. I should zip it. Sorry.
No, it's okay. It's on this slide. You're right in tune. So when we're talking about who are deemed close contacts, Brina just opened so well. If you are within 6 feet and you have spent a total of 15 minutes, whether that's little interactions that add up to 15 minutes over the course of the day, or whether it's a one-time 15-minute interaction at that close, less than 6 feet, then you are automatically deemed a close contact. Those who are in the same room for a long duration of time are also almost always close contacts, but we determine this on a case-by-case basis. And so it really depends on the details of the situation. And then the third category are those people that we cannot with certainty say if they were more than 6 feet from an infected individual for less than 15 minutes. And so this is why intermingling pods outside during recess is problematic. And so we need to really think about who we're interacting with and if our pods are interacting with others. It also can sometimes affect if you wander around the classroom or you're having activities where there's a lot of movement in the classroom versus like people being definitively in a space. So that's why for high school teachers and for teachers that push into the classroom, teaching from one part of the class for a majority of your class that's more than 6 feet away from students, And being aware of your movements and locations in the classroom is super important, so that if anyone comes to interview you, you can definitively say where you've been. If you can't definitively say where you've been, then we err on the side of caution and you may be deemed a close contact.
Thanks, Becca. And I wanted to reinforce that. I'm glad you said that. But in these cases, we are erring on the side of caution. So if we can't definitively tell that you have not been in close contact for 15 minutes or more, we're going to call you a close contact, and we're going to be conservative in our approach to that we can mitigate this spread. When I say we, the Department of Health.
So we wanted to give you guys examples of who would not be a close contact. So if you are maintaining your 6-foot distancing and you are keeping at that, we don't interact for 15 minutes, like riding the bus together. If you're more than 6 feet away, you're okay. If you're working in the room next door to someone, you're okay. If you're less than 6 feet for less than 15 minutes, like passing by someone in the hallway, or if you have a brief chat with them, as long as you're masked, you are okay and not going to be a close contact. We also do not count the second level of interaction. So you would not be a close contact if you were the sibling of a contact, of someone who was decided to be a close contact. You would have to have direct interaction for more than 15 minutes at less than 6 feet with the infected person to be considered a close contact. I also want to just reiterate that teachers and students, or staff members and students who are not present on the day in their infectious period, if they are not in school during their infectious period, then no one in their classroom would be a close contact. And you do not have to quarantine in these situations because they were not in school while they were infectious. Similarly, if there are students or teachers who are positive, but they've stayed at home, then you wouldn't have to be a close contact either, because you would not have been less than 6 feet for more than 15 minutes with them because they were not in school. So there's no need for people to go get tested or to think they're a close contact of someone who was not in school during their infectious period.
Thanks. And we've received a lot of questions about specifically sort of that second tier. And so I know it probably sounds counterintuitive to people, but you know, just sort of to reiterate, just because one person in your home has been asked to quarantine, that doesn't mean that everyone is quarantined. So those second level of interactions, you're not considered a close contact if you've been with a sibling or with a partner of a staff member who's been asked to quarantine.
Similarly, if a classmate was absent that day, the whole pod may be asked to go remote, or most of the pod may be quarantining. But if the kids were absent the day that the infectious child was there or the infectious teacher was there, then they would not have to quarantine because they did not have direct contact. So I just want to reiterate that in the general interviewing process, where we're trying to gain more information, just because someone calls you and asks you questions does not mean you are an automatic close contact. I think a lot of people's nerves got the better of them in this process, and they thought just because someone was asking them questions that they automatically were a close contact and needed to go get tested. So I just want to reiterate, just because we're asking questions does not mean you personally are a close contact. Okay, so the second meeting that we have with the Vermont Department of Health and the school team is really to share out information from those general interviews to determine who is definitely a close contact. If we are not sure, we sometimes do a second round of general interviewing and call people back and ask more questions, or call different people and ask questions. And then once we have this information, we create what's called a line list of close contacts to the positive person. And that line list is then shared with the Vermont Department of Health for their larger contact tracing purposes. And this again reiterates that when we're contact tracing in the school, we only look at one layer from the positive person. We don't go any further than those who have been in direct close contact with that infected person. So the next step in the process is we take that line list of the definite close contacts, and all of the close contacts are advised to quarantine. And I want to be really clear about this because I think there's a lot of confusion here. I think a lot of people think that the Vermont Department of Health is going to call them, but we as a team, the principal, the school nurse, whoever else is on that team are the people calling you as a partnership with the Vermont Department of Health. We are telling you things exactly the way the Vermont Department of Health would tell you them. They give us the exact information to tell you. But I just want to be really clear because I think some people in this process, parents and staff alike, have been waiting for a Vermont Department of Health person to call them. And so I just want to be really clear for everybody at this point that it's someone from your school doing that activity. If you're a close contact, you have two options. Vermont has a test out date. If you wait 7 days in quarantine and then you want to take a test, you wait for that negative result. And once you get that negative result, you can leave quarantine. If you choose not to test, that's totally okay, but you have to quarantine for a total of 14 days. On day 15, you may leave your home. So quarantining means staying at home, not going anywhere in public, not going to the after school program, not going to friends' houses and playing, not going to the neighborhood park and playing outside with other people. And you really shouldn't leave your home if you are the one quarantining. Now, that being said, this lovely heart in the middle, we realize that kids need love, and we realize that a lot of households have young kids in them. And so you're going to do your best to quarantine in your household if you're identified as the close contact. But the Vermont Department of Health realizes that it's not always possible 100% of the time because kids do need love. You can't have a little kid quarantine in their room by themselves all for those 14 days. You have to be real and a human being and realize that it's not always the case. So then we follow up those phone calls with an email that is exactly, it's information that the Vermont Department of Health has advised us to email to close contacts. And so again, the email is going to come from either your principal, your school nurse, an administrative assistant, an assistant principal. Someone from your school will be emailing you that information. The content is directly from the Vermont Department of Health. And it does say, dear parent, guardian, and your child in the language, but all of the instructions apply to staff as well. So if you as a staff member get this email, it is for you to follow those instructions as well. And then just so you know, Russ, did you want to talk about this part?
Yeah, sure. And so that's the communication that you're going to receive if you're a close contact or you've been asked to quarantine. That's the level of communication that's done on an individual level. And then what we're doing as a district is, within 48 hours we put that in there because just for a buffer, but it has been within 24 hours in each case here. And in some cases, even quicker than that. But our goal is to inform the impacted school community. And then at least bi-weekly, we're doing an update like the last one the superintendent put out that talked more about the total number of cases that we have and the total locations that we have. And we just want to clarify that that's not in an effort to not be transparent about what's going on. We are open to talking about this through this process with you if you have those questions. But it came to light for us when we had a number of cases within a number of hours that we needed to do communication about. And it felt like we were sending district-wide messages once and twice a day there about cases that might not impact people's families at all. So we have, like we said at the beginning of the call, multiple locations where there have been no positive cases. And so we've made the decision that we're going to reach out to those school communities, confirm. I'm sure that people start to hear when this contact tracing starts to happen. So Tom wants to reassure people that yes, there has been a case. Yes, we have looked into it. These are the steps that we've taken. And then we can do a report out on a more general level, not so frequently, but we can talk to the community about the number of cases that we've had and the locations that they've been in. That doesn't seem to be information that needs to go out at the same time that the school communities need to be reassured when those cases happen in their schools. So I hope that clarifies our communication piece and our effort to be transparent through this process and provide the information that you need when you need it.
So the last step in our process as a school is to send the line list, which has this information of all the close contacts to the larger Vermont Department of Health contact tracing team. Again, we're just a small piece of the larger puzzle of the contact tracing in the whole state and the whole region. And so these are the pieces that we submit to them. I do just want to highlight, I saw in the chat about the 3 and the 6 feet. So I just want to highlight really quickly that the guidance that we are following, the AOE guidance, does say that for students, it's 3 feet apart for grades pre-K through 6th grade. And it says 6 feet apart for grades 7 through 12. And it has always said 6 feet for adult to adult and adult to child distancing. So I just want to be really clear about that. And the other factor that needs to be clarified is that while the guidance says 3 feet for elementary classrooms, when we contact trace, it is always 6 feet that we look at. Rena, did you want to add anything to that?
No, I wanted to just acknowledge that it feels discordant, and we really grappled with this starting back in September. The science of 3 feet in little kids is completely solid, that there's minimal transmission, that distance is safe. We've got infectious disease people guiding us on our task force, and we put that in, and we haven't wavered on that, and that's been played out through multiple studies around the world. And yet, contact tracers are very literal, and they have their own little checklist and box, and they just wanted, out of an abundance of caution, use 6 feet as their rule because they're doing all workplaces, not just schools. And we went round and round about it in September, and we got a lot of advice from the CDC, and we ultimately landed that we're going to do 6 feet for contact, acknowledging to all of our administrative colleagues and teachers that we told you 3 feet is safe, and we're standing by that. So too many sentences, I know, but that's really important to me. And I just want you to know that contact tracing is a bit of an art, and it's based on, coming up on 1 year of experience with how this virus functions. And I did want to acknowledge at the beginning, or maybe now the middle, this is not a pediatric disease. So it's, anytime we have children in the mix, we're able to take all the CDC guidance, which is about adults, and we move it into the kids space with infectious disease specialists who specialize in kids and the way this virus transmits. So that's the little bit of discordance you're experiencing. I'm glad you pointed it out.
So that's the process. And now we're going to move on to what we can do and what individuals can do to empower themselves to stay safe while we're in school.
Before we do that, there's one more step that we do at the same time that I just want everyone on this call to be aware of as a BSD staff. Is at the same time that we give the contact tracing information to the Vermont Department of Health, our principals are then also circling back to human resources to let them know which employees have been asked to quarantine. So human resources may reach out. There have been some insurance mandates that have come down, that there's paperwork that now needs to be filled out, even if employees aren't positive testing for COVID. If they're in quarantine as a close contact, human resources is now having to do paperwork to comply with the state and with other agencies. So that's another piece that happens at the same time. And again, we value your confidentiality and just want you to know that, but let you know that that piece is also happening.
So before the day starts, you should be completing your health screening at home before you come to work. If you are sick with any symptoms, however mild they may be, please stay home. This is the best way that you can maintain a safe workspace and help our community stay healthy, is by staying home when you're sick. We also could screen all students and send any kids with symptoms to the nurse as soon as possible. Even though we do ask kids when they come in the front doors some questions, it is never a bad idea to check in with your own pod and in the very beginning of the day, asking them if anyone doesn't feel well, who needs to go to the nurse. And please make sure your seating charts are up to date. And this is not something we've asked you to do in the past, but we've learned from all these experiences that it would be really helpful if you could include where the adults might sit in that room as well. If you're a teacher who might teach from just the front of the room, it would be helpful to know where that is. If your desk is in the back of the room and you sit at your desk, it would be helpful to know that. If there's a para in your room all day working with one student, it would be helpful to know where their chair is in location to the student they work with. So that would be really helpful. And during the day, we really need to get into a more consistent habit of implementing the mitigation strategies. If we're consistent with the mitigation strategies, they will work for us. But without consistency, it's hard to determine how effective they can be. And this includes signing into and out of the rooms with exact times. And if you are a pull-in or pull-out service, doing that every time is super helpful. We use these contact tracing sheets very thoroughly in our process, and the more information that you can give us there, the quicker the process is for us, and the more information that we have to do all of these different steps. We also need to limit one-on-one interaction, whether that's adult to adult interaction or child to adult interaction. We need to maintain our distance and keep as much as possible 6 feet between our interactions with each other. And we need to stay masked as much as possible as well. We need to, I wasn't done yet. We need to limit the mixing of pods as much as possible, paying as a particular attention to small groups. We need to make sure that in small groups, the distancing is there, and we are limiting mixing and moving in the classroom to short stints or to a 1 15-minute activity, or less than 15 minutes. Make it 14 minutes. That'd be great. And then it's super important in the contact tracing. If you remember back in the slide of we're not really sure, if you can't say definitively that you haven't had one-on-one interactions for less than 15 minutes, this is where keeping the daily log for yourself. If you know for a fact that you had greater than 15 minutes of interaction at less than 6 feet with someone, just write it in your calendar. It doesn't even have to have like a timestamp. Just write their name in your calendar. And that way, if we were to come back and say on December 10th, were you less than 6 feet with anyone for more than 15 minutes? you could look back at your daily log and be definitive and know, nope, there was no one there, or yeah, it was one person and it was this person. And that will help us clear your name if we need to, or it will help us definitively say you are a close contact. So being definitive is super important.
Great. Thank you, Becca. So that is,
Becca, can I, oh, sorry, Russ, can I
Please.
clarify something that
please.
I'm catching up on the chat?
Yes, Sabrina, we would love your support.
Back to the beginning here. Okay. So when I was at the beginning describing contact tracing, I misspoke. I should have started, as I often do, with acknowledging that this is a humbling experience of making sure we say things in a clear way and that we're accurate, and chats always really help with that. The person with COVID will have a relationship with the health department's contact tracing team, but the close contacts to that person will be handled by the school communication, the great process Becca outlined, including understanding what your quarantine dates are and when you can test out. So I see earlier that someone noted they were a close contact and hadn't heard from the health department. That's because you're not the person with COVID. And I think I explained that incorrectly at the beginning. So, and that's because of, the greatness of your teams and this partnership Becca's described, where we're all one in our work to give you a day 0, a day 7, a day 14, and to talk about the importance of testing out and how to do that. And then I also note a really important question. The CDC did change its quarantine guidelines, but the Vermont did not amend ours after that shift. And the reason was pretty straightforward. What we were doing is working. We felt that we had done a lot of good communication and public engagement on day 7, get a test or stay home for 14. And when the CDC said you can test at 7 or head on out at day 10, we thought the people are going to start counting funny. And so we stuck with 14. And I appreciate that question. So I'll stop there.
Thanks, Sabrina.
Great. Thank you. So that's the contact tracing process and what you can do to stay safe. And then we have a couple more updates from the district side of things. So we are happy to again be participating in the surveillance testing with the state. We have been given our next date as Wednesday, January 6th is the next day that we will be able to provide free surveillance COVID testing. And we are going to send out more information likely today on this. It was going to happen a little bit earlier today, but things sort of got sidetracked here. We're going to have that at 2 locations, at EMS and at Hunt. We're going to ask that the EMS location serve staff from BHS, BTC, On Top, and Horizons, as well as food services, property services, and staff. And we would ask that if you're not in that list, that you would go to Hunt to have your test done. We're going to have the sites open from 10 a.m. to 6 p.m. I understand that a lot of people will probably be taking up the opportunity to get tested in the afternoon on Wednesday. So if you'll see more information about this today. You will have to register online. It might be tomorrow that we send it out. Maybe not today. Sorry if I misspoke there. And just remember that there will be no walk-ins or day of registration. So we'll get that information out to you. Make sure that you sign up when you are able to do so.
Russ, can I just make one point about the registration? So when you register, it will ask you to register for a specific time. But when we actually do the testing the day of, it will run like a drop-in center from 10 to 6. So the actual time you sign up will not matter. Just show up anytime between 10 and 6 if you are registered.
Thank you, Becca. That's really helpful to know. The next piece that I want is, and there's also, if you don't want to wait until January 6th, superintendent's last message to the community last week included a link to testing options around the city of Burlington, which are also free. So you can definitely take advantage of that if you feel like you want to do that right now. If you want to get, tested anytime in between now and January 6th as well. So please find that, and we can share out that resource if you'd like when we share out the slideshow and the recording later. The next piece that we is really important. It's an update that we received from Human Resources, and essentially that is, unless Congress acts, the FFCRA is scheduled to expire on the 31st. And so basically that is the provision that has allowed payment to people who are in quarantine, particularly for travel that wasn't necessary. So that is going to expire unless Congress acts. So we just wanted to remind you of that, that if you've engaged in non-essential travel over break, please plan ahead so that you can complete your quarantine and you can come back to work on January 4th. If you cannot work and remote work is not available, if you can't work because you're quarantined and remote work is not available, we're going to be looking at using leave time to cover that time out. So that's a really important reminder, I think. Hopefully people are not planning to engage in non-essential travel anyway, but definitely didn't want you to be blindsided by that. And I believe our director of HR is going to send out a little bit more information on that today as well. So with that, we're going to take it over to Tom.
All right. Yeah. So first, I want to kind of reiterate my thanks to our staff, to all of you who have, I'm in schools, I'm in classrooms every day, and I see schools running at full speed and taking students' social emotional health and their learning extremely seriously each and every day. And I know these are extraordinarily stressful times, and you all are on the front lines doing this work each and every day. And so I want to thank you for that, and know that the entire community of Burlington, beyond our schools, is grateful for the work that you all are doing. I want you to make sure you have a safe, but also a restful and a joyful break. It's been hard work up to this point, and we need to take time to recharge. We need to take time to be with our families in person if we can, and we're minding the rules and virtually if we can't. And so I hope that you all have time to take time and to recharge. I think it's really important for us to be ready to come back when we come back after we've had time to take a break, and know that the precautions that we have in place are keeping people from getting sick and keeping our schools safe. And so we do need to make sure that we're sort of rebooting on all the protocols, making sure the seating charts are there, the sign-ins are happening. We're really maintaining the distance. I've been through classrooms across the district, and I'm seeing us maintain the distance, but I can also see times where, naturally as human beings, we come together. And we just have to be really careful about how we're interacting with each other, and really mindful of the requirements, and taking them very seriously. Outdoors at recess, kids need to have fun and play, but we've got to try to keep pods of students together. There are some kind of vulnerable places that we need to make sure that we're being really diligent about the guidelines. We are going to make sure, and we did before break, make sure that we're doing the safety protocols before students come in. So doing those checks as students are coming in the building, and when they come in the building, to make sure that we're asking those questions about how they're feeling. That's probably, I think, the most important thing for us to do is to check in with students individually as they're coming in, and right away, to make sure that they're not feeling sick. Students, will disclose to us sometimes in a way that they may not to other people, because you're a trusted person for them. So I don't know, there's a lot on this slide, but really I just want you to know that, that I thank you. that the community thanks you, that you've been working extremely hard, and we're going to get through this. But it's not because it's not easy, and I get that, and so let's take some time and decompress, and then come back and be ready to go. Thank you, and thank you, Dr. Holmes, for being on. Thank you, Becca and Russ. Becca has been leading us amazingly through this time. She's been working nearly all waking hours for the past 2 weeks, and our school nurses have done an amazing job. Our principals, in some cases, and a couple of other staff in each of the buildings who help with the contact tracing, and it's really held us together as a community. So thank you all, and happy holidays.
Thank you, everyone. We have saved the chat, so we'll go back and look through there and make sure that we've addressed a lot of these questions if we can. And also we'll be sending out the presentation to everyone. So thanks for coming. Let your coworkers know. We'll send out the recording as soon as we can. And then remember that, you know, for a lot of the questions that are being asked in the chat are not necessarily school specific. We can take an attempt at answering those and putting something together, but the Vermont Department of Health is an amazing resource for you. They can talk to you about infectious periods. They can talk to you about contact tracing. They can talk to you about so many of the questions that you're asking. So we'll do our best to answer those as well. And we just thank everybody for being here today.
I would also just add that there may be questions that you ask that we cannot answer for confidentiality's sake. And so we are going to do our best to answer what we can, but there may be some that we cannot answer at all.
Great.
Thanks for
Happy holidays, everybody.
Thank you, everybody. Appreciate it.